Good day, I am Miss May Isabel Batario, and today I will be performing our turn demonstration for the hair care. So for today, I will be putting my device, my gadget down here for you to be able to see clearly the procedures that I will be doing. So excuse my client as my client has her online classes, so she will be using her phone. So um, now, to proceed with the procedure or the return demonstration, firstly, in providing the hair care, we have to firstly determine any of the followings that needed to be determined. So, firstly, we have to determine the history of the following conditions or therapies of the client. So, now I will be asking the client. So, ma'am, have you had any recent chemotherapy?
No,
How about hyperthyroidism?
no,
Okay, how about radiation of the head?
no,
Unexplained hair loss?
no,
What about growth of excessive body hair in any parts of your body?
no.
Okay, so no. So that is noted, ma'am. So now we can proceed with determining the usual hair care practices and the routinely used hair care products of the client. So, ma'am, may I ask, what do you use in doing hair care? Like, what kind of brush or comb do you use? Separated tooths, or do you also use shampoo or conditioner? And may I know also what type of brand?
I use separated the of the brush. I actually use shampoo and conditioner, which is the brand is Keratin.
Okay, so keratin. So that is noted, ma'am. Now we can proceed with determining whether wetting the hair will be will make it difficult to comb. Especially if the client has kinky hair, it is easier to comb when wet, and it is very difficult to comb when it dries. So, in identifying these underlyings, um, this can serve that it might affect the hair care and prevent complications. So, early identifications can help tailor the care for our client. So now we can proceed with the assessment. In the assessment, we have to assess the condition of the hair of the client and the scalp. And we have to assess if the hair is straight, curly, or kinky. Or is the hair matted or tangled, or is the scalp dry? So, in assessing the condition of the hair and scalp, we have to um, part the hair of the client. So, just checking for any lesions or infections that we can see and observe, and also for the condition of the hair and scalp. For the condition of the hair, I can see that our client's hair is slightly curly at the bottom, and it is straight at the top. So I have also observed. Okay, so ma'am, I'll just be parting your hair just to see it, just to observe and inspect for your scalp if it is dry or oily and such. Okay, can you turn your head to your left? Okay. So, ma'am, upon observation, I have observed that the your scalp is dry, and it has no signs of any infestations of lice and such. So, we have also to assess the evenness of growth, of hair growth, over the scalp, in particular any patchy loss of hair, the hair texture oiliness, thickness or thinness, presence of lesions, infections or infestations on the scalp, and presence of hirsutism. And also we have to assess the self-care abilities of the client. For example, is to assess the any problems managing hair care. So again, upon inspection, and as I have inspected earlier, I have not seen any um, um, infections, lesions, or infestations on our client's scalp. And also, I have not observed any signs of hirsutism, as there are not many hair growth on any on particular areas of the client's face, neck, or on her arms. So, as for the evenness of growth, I have seen that there is evenness of growth in parts of the client's hair, as I have not seen any spot that has hair losses. So, in assessing this part, we can ensure that we adapt the hair care process to the client's needs and limitations and detect potential health problems early, such as the infestations. Therefore, we can now proceed with the assembling of the equipment and supplies. So for the equipment and supplies, what we will need is a clean brush and comb, a wide tooth comb, which is, as I have said earlier, is usually used for many dark-skinned people because finer comb pulls the hair into knots and may also break the hair. So now, we can proceed with the supply, such as the towel and hair oil preparation if appropriate. So, hair oil can help us in untangling some hair of the client. So it is smoother and easier to comb. So now we can proceed with the procedure. So for the procedure, we have to explain to the client what we are going to do and why this is necessary and how they can cooperate. So, ma'am, what we will be doing today is providing you hair care where we'll be going to comb your hair. This is for us to untangle any tangled hair on your head so that you can be more comfortable. Okay, ma'am? Okay.
Yes.
Thank you so much. And how you can cooperate with me is just be there, um, comfortable. Just be there comfortably and just do the things that I will be needing you to do. Okay, so this promotes client understanding and cooperation, and also reduces her anxiety. So now we can proceed with washing our hands and observe other appropriate infection control procedures. So assuming that I have washed my hands earlier, the other appropriate infection control procedure is wearing gloves, such as what I am wearing now, and also applying alcohols that which can um, prevent infection or prevent transmissions of other microorganisms and for her safety and my own. So now we can proceed with the providing our client her privacy. So, ma'am, may I know, would you like me to close the curtains, the door?
Yes.
Okay, providing client privacy. And also how we can provide her privacy is to provide her blanket. This is for her to keep her modesty, dignity, and also warmth. So, in providing client privacy, ma'am, would you like me to put this blanket on your chest
Yes.
area? Okay. Let me just assist you. Okay, so now, so after providing our client privacy, now we can proceed with positioning and preparing the client appropriately. So this prevents strain or injury during the procedure. So we have to assess the client who can sit to move to a chair. But if health permits, we have to also assess the client to a confined bed to a sitting position by raising the head of the bed. Otherwise, we can assess the client to alternate side lying positions and do one side of the head at a time. But as for us, we will just be using a supine lying position. And if the client remains in bed, place a clean towel over the pillow and the client's shoulders and place it over the sitting client's shoulders if ever that our client is indeed sitting. So now what I have here is my towel. So ma'am, this is my towel which I will be using to put under your head. So let me just assist you, ma'am. Okay, so placing the pillow, okay, under the client's head and over the pillow. Okay. Can you please just raise your head again, ma'am? Okay. Thank you so much. Okay. So now that we have placed the towel on under the client's head and over the pillow, now we can proceed with removing any mats or tangles gradually, as this prevents pain and hair breakage. And mats can usually be pulled apart with the fingers or worked out with repeated brushings. So also comb out, we have to comb out tangles in a small section of hair toward the ends and stabilize the hair with one hand and comb toward the ends of the hair with the other hand. So now I will be proceeding with the untangling of the tangled hair and mats using just my fingers if I can. So here I can untangle them just using my fingers. So after this one, I will be using the comb. So ma'am, just tell me if you are experiencing any discomfort in this procedure, okay ma'am? Okay, so untangling them now, the ends of the hair. This is for us to avoid any more tangles if ever that we start on the upper side. So ma'am, can you please turn to your right? Your head to your right. Okay, thank you so much, ma'am. So now that we are done with the ends, we can now proceed with the uppermost part of her hair. Okay, so to your left, please. Okay, thank you so much. Okay. So thank you so much for your cooperation, ma'am. So now we can proceed with brushing and combing the hair as I have did earlier. And if ever that our client's hair is short, then we have to brush and comb one side at a time and divide long hair into two sections by parting it down the middle from the front to the back. And if the hair is very thick, we have to divide each section into front and back subsections into several layers. So just as I did earlier, I have divided her hair into subsections, and this is to add gentle handling that prevents hair damage and scalp injury, and also this minimizes discomfort for the client, and it also stimulates circulation to the scalp. So now we can proceed with arranging the hair as neatly and attractively as possible according to the individual's desires. This will promote the client's comfort, appearance, self-esteem, and helps prevent tangling and matting. So for that procedure, we can ask the client if they would like their hair to be braided, as this helps prevent any more tangles. So, ma'am, may I ask if you want me to braid your hair or just leave it lying down?
Leave it lying down.
Okay, so the clients wants it to um, leave it as there lying down. So now we can proceed with documenting the assessments and special nursing interventions. And daily combing and brushing of the hair are not normally recorded, but the documentation promotes or provides a legal record of care and tracks any problems such as scalp sores or hair loss, and it also informs the healthcare team for further interventions if needed. And overall, providing regular hair care is not only about hygiene, it also supports prevents and it also supports the client's comfort, self image, and psychological well being, and while also preventing infections and um, conflicts related to immobility. So now that we are done with the providing hair care and we are done with the documentation, we can now end this return demonstration and proceed to the other one. Thank you so much.